Esophagectomy is the removal of the esophagus. It can be removal of a portion of the esophagus, or in most cases, it's almost a complete removal of the esophagus. And in the majority of cases, we replace the esophagus with a tube created from the stomach. So the stomach is actually moved from the abdomen either up into the chest, or as we do it, all the way up into the neck area. Almost all of the patients who undergo removal of their esophagus are having it done for reasons of esophageal cancer. There are a smaller number of patients who have it removed for benign disease. Sometimes children or young adults who have a caustic injury may need at some point to have their esophagus removed, but the great majority are usually due to cancers of the esophagus. At least right now, the greatest risk factor for developing esophageal cancer is thought to be chronic gastroesophageal reflux disease. So people that have chronic heartburn are on medications for that. It's thought that the combination of acids injuring the lining of the esophagus, followed by some of the bile going up into the esophagus, cause changes within the esophagus that wind up leading to esophageal cancer. So with the great millions of people who have gastroesophageal reflux disease, those are the ones that over the long term are potentially at risk for developing cancer of the esophagus. Correct. This is also one of the newer procedures that's come along in the minimally invasive era, where this used to be an operation that was done with either incisions in the abdomen, the chest, and sometimes the neck, a combination of 2 or 3 of those. Now we do the same operation using a combination of minimally invasive techniques. So the modification that we use here has been to go into the chest with the scope and get the esophagus ready for removal from the chest. Then the surgical oncology team will go in through the abdomen and prepare the stomach into a tube. Once the stomach has been stapled and made into a tube, we then pull it up through the chest and then put the stomach and the esophagus, the small part that's left behind in the neck, together, and that's what reestablishes continuity of the GI tract and allows patients to resume eating. Patients who've had their esophagus removed can be expected to live normal lives. There are some modifications and things that they have to adjust to in terms of size of the meals that they eat, and usually not eating right before going to bed. They do tend to have a little bit more in the way of reflux symptoms if they lie completely flat after eating a meal, but otherwise they're able to maintain their weight, eat all the foods that they want to eat, and just kind of usually have to adjust a little bit in terms of the volume and when they wind up eating. This is probably even more uncommon than actually removing parts of the lung with the scope. This requires usually a team that's comfortable with dealing with diseases of the esophagus to start with, but also have an expertise of doing minimally invasive operations, which is again why we do it as usually a 2-team approach to deal with the chest and also with the abdomen. I'm Dr. Rudy Lackner, a thoracic oncologist at the Nebraska Medical Center.